My name is Ozioma Chukwudi. I hail from Anambra State. I'm the first of a family of 4. I have degrees in microbiology and public health. I'm an embryologist in the Clinical Embryologist in St. Ives Specialist Hospital. I've been a clinical embryologist for the past 6 years. I've had my trainings both locally and internationally. And I have a passion for completing families, for assisting couples that have challenge with infertility to have take-home babies. My favorite quote in life is, "What will be, will be." The importance of my specialty to the total healthcare promise of St. Ives is to actually help couples that have challenge with infertility, have take-home babies. Infertility is known to be a major healthcare challenge in Nigeria now. So what I do as a clinical embryologist is to help couples who have this challenge with infertility have take-home babies by doing in vitro fertilization of eggs and sperms outside the body, and transferring back embryos into the uterus of the women. And then they have take-home babies, and that's the importance of my specialty to the total healthcare and promise of St. Ives. It's been a very wonderful experience in St. Ives Specialist Hospital, I must say. For the past few years, I joined St. Ives. It's a very nice place to actually work in, somewhere where you can be free to do what you want to do, somewhere where you can explore your career, grow, be trained. St. Ives has given me the opportunity to exceed my limits, to see what I'm capable of, and it's been a very wonderful time at St. Ives, I must confess. 3 healthcare tips in my area of specialty in fertility. I must say, first of all, there are a lot of men who are going sterile who probably have challenges with their fertility. So I would advise young men to please watch their lifestyle, try to reduce their consumption of alcohol, and those of them that probably do drugs should please stop doing drugs, as this could affect their sperm counts. More so, STDs should be treated early, as this might also block the testicles and also make the sperm count low. More tips, consume more vegetables rather than having processed food, as the rate of infertility is on the increase now. Bet you didn't know some facts that are actually strange to us. Well, the length of your nails is determined by how long your fingers are. So if you have longer fingers, your nails grow at a very high rate. Secondly, a woman who's 60 years old, as at the time she's 60, she must have produced at least 450 eggs that could make babies. Well, there's been a lot of funny experiences on the job, but I would say a very remarkable experience for me on the job will be when a couple who came in here after 25 years of infertility in 2016 came for their IVF treatments, and they had never been pregnant, and they've had about 9 failed cycles, both in Nigeria and abroad. And then they came in again and they said, this is the 10th one. And I said, okay, by God's grace, this would work. And then they came back, they finished all their procedures, came back for their tests. I must say that was the happiest day of my life when the woman tested positive after 24 years. And then she came for scan and she was carrying twins. And then afterwards, she had 2 baby boys. And all glory to God. That's been my most wonderful experience so far in St. Ives Specialist Hospital.